The Radical. Fundamental principles of freedom, rational self-interest, and individual rights. This is the Yaron Brook Show.
All right, welcome everybody. I hope you're doing, as well as you can be doing. At the very least, I hope you're all healthy and safe and haven't gone crazy, given the insanity that I think we're all experiencing in the world around us. So these days, you have to wish people safety, health, and sanity, because none of those should be taken for granted at all. Thanks for joining me on this Friday night. Yes, it's Friday night. I hope you had as productive a week as you could possibly have, again, given the circumstances. So we're still in coronavirus. Again, I'm open to other topics that you guys want to talk about, but it seems that kind of dominates the world around us, and there's still so much nonsense going on and so much nonsense happening that it's worth to continue to talk about it. I don't know about you guys, but I'm still outraged. I still think the response to this, the media, our political leadership across the board, with the exception of a few I'll talk about in a minute, the incompetence, the stupidity, the ignorance, the evasion, the lack of planning, the lack of data, the lack of knowledge, the lack of statistics, the lack of anything is just astounding. The only exception is where you see competence, and you see incompetence in hospitals, primarily in doctors and nurses and hospital personnel treating the victims of this coronavirus, and the heroic efforts to do that. You see competence in the private sector, which is managing somehow to deliver goods and services to all of us while we're locked up in our homes. The competence of medical technology companies trying to come up with treatments and vaccines, the competence of companies designing new tests. Every day I read a story about a new test, a new methodology that of course is waiting for FDA approval, but a new test, a new methodology that is out there. I just read something out of, I think, Rutgers University. They have now basically a machine, I guess, that can process thousands of tests a day. So one machine that can do thousands of tests a day, which I guess in the past was only dozens of tests you could do at one time. So truly, truly you can see competence, but the competence is all in the private sector or in the hospitals, which are part private, part public. It is in those sectors of the economy where government is not involved, but everywhere else, including the media, just on and on and on, nonstop. Either anecdotal stories about the horrors of things to frighten the bejesus out of you, or stories about deceased people that are just trying to tug your heart. Whereas, people die. People do die all the time, and it's never nice. It's never pleasant that people die, but people do die. That's part of reality, and dying of a disease is not that unusual. And we got a virus. People are going to die of this virus. People are going to die from this virus. A lot of people are going to die from this virus. That's a reality that we just have to accept. And it seems like our politicians, media people, some doctors even, refuse to accept that reality. And suggesting that the price to pay for trying to save every single life is basically infinite, and we should, stop everything, stop our lives, stop everything else in order to save every marginal life, every additional life. No life is marginal. But that can't be true. So it's very tough right now. It's very difficult because clearly the disease is horrific. The people it affects and the people who suffer the worst outcomes or the worst symptoms are really horribly affected. Many people are going to die. Many people are going to be very sick. Many people are going to be sick and going to suffer the consequence of that sickness for a lifetime. And that's part of reality. That's just going to happen. And yet, if you say that, you're considered cruel and uncaring, and you don't care about human life, and you don't care about anything, and because somehow we are supposed to live, the standard for life is somehow some place where there is no death, there is no risk, there is no danger, it's a Garden of Eden. The standard of a good life is Garden of Eden. You just sit around and eat and everything's available and you never worry about anything, never consider anything, never think about anything, never challenged by anything. But that's mythology. That's not a life. That's a caricature of a caricature of I mean, who wants to live a life like that? It's boring and uninteresting. Nothing gets produced. Nothing gets created. There's no passion. There's no interest. There's no knowledge. There's no truth. There's nothing. There's just drift. Might as well just take a bunch of drugs and drift. That's Garden of Eden. Garden of Eden is a fake. But if it's not a Garden of Eden, then life involves struggle. It involves competing values. It involves risk. It involves danger, and it involves accidents that are outside of your control. Somebody says, isn't the concern that hospitals will be swamped? Yeah, I mean, hospitals might be swamped. And now put that aside. Put aside whether you can do something about hospitals being swamped. I've already said many times in the show that the things you can do, you can deal with problems of supply. When demand goes up, markets deal really, really well with problems of supply. But put that aside for a second. Let's say it's inevitable. It's metaphysical that hospitals will be swamped. So hospitals will be swamped. I mean, it's sad. Nobody celebrates that. More people will die than would die if the hospitals weren't swamped. But what are we willing to do in order to prevent hospitals from being swamped? Stop all economic activity for weeks, months? How long? And we flatten the curve this time, so hospitals, let's say, are not swamped, although arguably they were swamped in New York. Okay, and then we release everybody out, and then the curve starts up again, so we shut down the economy again. How many times are we willing to do that? How many lives have to be disrupted? How many jobs have to be lost? How many people in depression, suicide, or dying from other diseases because they won't go to the hospital because the hospital is so focused on coronavirus? How much pain and suffering are we willing to tolerate so that hospitals won't be swamped? Now, I think there's a solution for hospitals being swamped. Now, it's not an easy solution, but it is a solution, and that is to fix the supply problem. Now, the longer we have waited, the more difficult it is to solve the problem. But let's be clear, we knew this was going to be a problem in January. Somebody asked, who go into the medical profession if it means risking a death sentence? Lots of people, because lots of people recognize that there are risky professions. And it's not that it's a death sentence automatically. It's if there's a pandemic, if there's this massive emergency that happens once in probably 100 years on the scale that we're seeing, then being a doctor becomes dangerous. I mean, there are medical doctors in war zones who are taking the risk every day in a war zone. Now, they chose to be a medical doctor, some of them. Some of them are forced into that, but where there's what do you call it, a draft. But to be a doctor means to work among sick people. You're taking a risk. You could be infected by a lot of different diseases. I mean, the doctors who deal with Ebola patients. Ebola is a far more deadly disease than this is, and yet they're doctors who engage in risky activity, to save lives. It's what they do. Now, not all doctors, not a lot of doctors, but many doctors engaged in risky activities. That's part of the job. And a pandemic doesn't come every week. A pandemic doesn't come every year. It doesn't come every decade. So doctors during this period of time will have it hard. It'll be difficult. It's part of what they signed up for when they became doctors. They would have to deal with really, really difficult situations. Really, really, really risky situations. So Jackie says the problem is adequate PPE, and I agree. But again, that is a supply problem. That's an economic problem. It's not a political problem. In a free market, at least, it's not a political problem. It's not a medical problem. It's not a coronavirus problem. It's an economic problem. It's a supply problem. It's a business problem. And in every other field that we know, in every other area of business, if we can predict a surge in demand for your product, what happens? You invest massively into producing more of that product. And whether that product is hospital beds, whether that product is PPE, personal protective equipment, masks, gloves, whatever it happens to be. The problem is not that supply and demand suddenly doesn't work, not even that you can't respond fast, because you can respond very fast. Look at all the field hospitals that the U.S. Army has put up in places like New York. Why wasn't the U.S. Army, which is master in logistics, why wasn't it activated earlier to set up field hospitals in places that we expected to become hot zones? Why is the only answer but state after state after state to shut down everything, shut down the economy, keep everybody at home? And it seems like in spite of that, many places are suffering from the coronavirus and suffering death and suffering hospital overloads. But look, what happened in New York hospitals was horrible. But it was predictable. Why couldn't we have paid extra to have doctors come down from, I don't know, from other states, from South Carolina, from North Carolina, I don't know, and come help out? Why couldn't we have got mask production ramped up in time? Why couldn't we have gotten field hospitals set up in time? I mean, we did, and a lot of those field hospitals weren't actually used. And what happened was, probably the shortages of doctors, of anything else, and PPE. But why were there these shortages? That's the question to ask. And yes, I have no problem with lockdowns if they're short, if it's clear when they end. But they're going to go on for weeks and weeks and weeks with no real standard. There's no plan. I mean, I've read some plans on some websites on how to go back, but there's no plan. Como hasn't presented a plan. Trump hasn't presented a plan. Nobody's presented a plan for actually opening the economy and getting people returning back to semblance of normalcy. But until you have such a plan, the assumption is we're going to be locked up forever. And it's insane. Now, again, I'm not saying you don't, in an emergency situation for a short period of time, have lockups. But where's all the testing? where's all the testing? We've had what? All of February, all of March, 10 days into April. Where's all the millions of tests? And the problem is that even when somebody like Trump goes out to say, oh, we need to reopen the economy, he is being so discredited. What he says is so meaningless. What he says is so random that there's no leadership. There's no leader in the White House to lead us out of this. All this is basically is random stuff coming out of the president's mouth. Nobody knows what to make of it, what it means, whether he'll change his mind tomorrow. So it's generally, thank you, Vonda, really appreciate that. It's just, there's no leadership, nothing. No vision, no plan, no consistency, no principle, no ideas, just playing it by ear, which is what pragmatism is. And I've always told you, Trump is a pragmatist, complete and utter one. And of course, what's happening is hospitals are not doing, Daniel just tells the story, his mother just had surgery, pancreatic cancer, and the whole sections of the hospital that are empty because the hospitals are not doing elective surgeries. But a lot of elective surgeries are not really elective. They need to get done. A lot of people are not being diagnosed for cancer that need to get diagnosed for cancer. There are a lot of surgeries that are cancer-related that need to happen today but are going to be pushed out into the future because we're not doing so-called elective surgery. Oh, Cesar says I'm becoming annoying. Not sure why. I've always been like this. I don't think I've changed. Wow. Thanks, Vonda. And then, of course, and then I'm going to talk about the numbers, and then I want to talk about inequality. Then, of course, we constantly get a barrage of numbers. Every day. Every day. You get more numbers and more numbers. How many people have died, and how many people are infected, and how many people maybe in some places are tested, and how many people are hospitalized. But in many respects, these numbers don't really mean anything. Because we're testing so few people, you don't know what the mortality rate is. We have no idea because we don't know how many people are actually infected. Because so many people, we don't know exactly how many, don't have symptoms. And the fact is right now, according to the CDC and according to hospitals and states, we're only testing people with symptoms. And then, so we don't know how many people have it. So we can't calculate hospitalization rates or real death rates. And then even the death numbers have to be suspect. I'll give you an example. In Puerto Rico, yesterday, they upped the number by 9 or 10, right? And they said, look, it's not as alarming as you think. All we've done is recategorized deaths that had already happened. So it's not that all happened in one day. We looked back and we looked at all these, and we recharacterized deaths that happened of people who had coronavirus symptoms who were not tested for coronavirus. We categorized them as coronavirus deaths. How did right? So yeah, the numbers are going to be inflated in that sense. And then the people who have coronavirus and who might be dying of heart disease or cancer or diabetes or something else, and they're all going to be categorized as coronavirus deaths because they have been tested. But even if they have symptoms now, at least in Puerto Rico, they're categorized as coronavirus deaths. That's not the case, by the way, in Germany, from my understanding. My understanding is in Germany, they're categorizing the death based on the underlying condition, at least in some cases, not just based on whether they have coronavirus or not, but based on what the doctor actually thinks killed them. And it's confusing, and it's hard to tell what kills somebody. And if somebody dies 3 months earlier than they would have died, or 6 months earlier, as many you would assume is the case with many 85-year-olds or 87-year-olds who have significant pre-existing conditions, and I don't know what their life expectancy is at that age. It's not that. I mean, how do you categorize these things? So we really won't know how many people died unless we start comparing deaths in previous years during these months with deaths right now and maybe dig a little bit deeper into the numbers. But right now, there's a massive incentives to inflate the number. Now, I don't know to what extent that's happening. I have no idea. But again, in Puerto Rico, I just gave you an example. The number went from basically from 30 to 39. So it went up by 33% based on just a little recategorization of who they count as a coronavirus death. And of course, the reason they are bumping up the numbers is because on Sunday, the governor is going to announce what's next with the lockdown. And she's going to announce an extension of the lockdown. Because the higher the deaths, the higher the counts, the easier it is for them to justify the lockdown. And politicians have a massive incentive to increase the lockdown. Because nobody's going to penalize them for locking the country down. Oh, they're saving lives. They're being responsible. It's what the doctors all say they should do. Right? But if they open up the economy and suddenly people start dying, oh my God. So Pupik asks, he says there's no super chat in Israel. All right, but you owe me. Right? When I come to Israel, I wanna check. You can pay in shekalim, you can pay in Israeli currency. Assuming we open the market for people that are not in danger, young people and people that are not at risk, should all people at risk be quarantined? Does that include caretakers? Well, I mean, I think if you're going to quarantine anybody, in a sense of isolate anybody, people who are at risk of dying from this disease should be the people you quarantine. Now, it's difficult to do. So, but the first thing you have to do is old people, anybody over the age of certainly 70, maybe even 65. And you can do that, you can take some of the money the government's just throwing out there, the $2.2 trillion, and you can invest in helping people isolate their mothers and grandmothers. You can also, caregivers. Caregivers is a challenge. But again, caregivers you can make sure they're well trained in wearing masks, in wearing gloves if that helps, in washing their hands regularly, in cleaning surfaces. Test them. Test them once a week. Test them twice a week. Test them every day. Focus the resources, focus the money on protecting the people who need protection, primarily older adults. And then with younger people, it's that portion of the younger population with pre-existing condition. Now, it's true. A lot of people have pre-existing conditions. The primary ones are high blood pressure, diabetes, and both of those are associated with obesity. So invest the money in providing resources for people to be able to self-isolate themselves who are at risk, whether they're at risk because of pre-existing conditions or whether they're at risk because of age. And focus on that population. And for the most part, leave the rest of us alone. Now, there are problems in households with multi-generations. And we'll get to this, but that's particularly true among poor Americans. Poor Americans tend to live in much more crowded environments. That's why they're suffering more right now. They tend to have multi-generations, just like Italians in Italy. One of the reasons it hit old people so badly is because Italian households tend to have multiple generations in them. And therefore, old people got infected from young people who came back from traveling to places like China. And they got infected very quickly. So you've got to take those multi-generation, maybe give them a financial incentive. Again, if the government is spending this amount of money, maybe give them a financial incentive to put their father or grandfather in a hotel or in a facility that specializes. And maybe there's a profit opportunity here to create facilities that specialize in helping older adults isolate themselves. I mean, that's what would happen in a market. In a marketplace, you'd have hotels and places like that converting themselves into places that people could self-isolate themselves. But we're not allowing markets to work right now. Everything is regulated. Everything is controlled. So it truly is horrific what is going on. Okay, so I want to make 2 more comments. And then I've got like 25 Super Chat questions, so we'll try to get to them. First, it didn't take long for the deaths of this virus to be blamed on the thing that the left loves to blame everything on, which is inequality. Didn't take long at all for inequality to become the thing that we blame the coronavirus deaths on. So, story in Atlantic, which has a lot of useful stories, and this one's useful too by revealing to us what people are thinking. It's called "The Pandemic Will Cleave America in Two." Basically, the haves and have-nots, the standard. And this is the argument. The argument is that people who are dying are primarily people who have pre-existing conditions. Indeed, there is just today there was a report from where is this? There it is. From the CDC. From the CDC. That says that 90% of coronavirus, let me get this right, of coronavirus hospitalizations, about 90% of patients, people who are going to hospital, have pre-existing conditions. Now, 90% is an unbelievably high number. And the pre-existing conditions they list are hypertension, 49.7%, obesity, 48.3%, chronic lung disease, 34.6%, diabetes, 28.3%, and cardiovascular disease, 27.8%. But over 90% of hospitalizations, according to the CDC, is from pre-existing conditions. So Liberal Deutsch is saying Germany is banning most physical contact with people for 80 million people for a month till April 19th at least. You call that a great job? I never called that a great job. I said Germany did a good job testing early, isolating people early, and as a consequence, Germany has a relatively low rate of fatalities, of death. And Germany is also, I think, trying to categorize deaths more appropriately based on actual cause of death, not just instinctively everything corona death. But I don't justify the banning of physical contact for the whole month. I've spoken extensively against that, whether it's in Germany or here. Banning is bad. That's not a great job. The great job was the testing that they did early on. They did a good job in testing. They managed to isolate a lot of people early. And they could have been further ahead today in deaths, and they're not. They have lower rates of death. And plus, Germany has more beds per capita than other European countries that had more beds per capita in hospitals, in ICU, than the United States by a big factor. Germany's better prepared to handle this than most other countries for a variety of reasons. But that doesn't mean I am what do you call it? That I approve of everything Germany has done. Quite the contrary. All right, so the argument is that people are dying of pre-existing conditions. Well, who has pre-existing conditions? Well, overwhelmingly, pre-existing conditions are in lower income populations. Now, you're seeing this all over the news. They don't talk about this in terms of lower income. What they talk about this primarily is on, instead of pre-existing conditions, they talk about this in terms of race. They talk about the fact that disproportionately African Americans are dying from this disease disproportionate to their percentage in the population. And that looks like that's absolutely true. But that has to do with poverty. And poverty is indeed correlated with bad health outcomes. Poor people are more likely to be obese. Poor people are more likely to have diabetes. Poor people are more likely to have high blood pressure. And there are a lot of reasons for that. Some of those are choices they make, but some of those are a consequence of the high cost of healthcare or the inconvenience of healthcare to poor people. And I think that is a consequence of all the government programs to help poor people actually make healthcare worse for them, whereas a purely private system would actually supply them with a better, higher quality product, more focused on prevention and less focused on treatment, because that's how you really save money in healthcare, is by prevention, and that's what insurance companies would emphasize if they were allowed to be free. They were allowed to offer products to poor people. So it has to do with choices that they make, often bad choices that they make, not exercising in the food that they eat. But it also has to do with the fact that they have less access to health care because they have to go through Medicaid, which is an awful, awful system. Medicaid, which is a government-run health care, is worse, has worse outcomes than private insurance, worse outcomes than Medicare, worse outcomes than probably socialized medicine in socialized medicine countries. I can't think of a worse system than Medicare, but that's what we provide old people. God forbid, we actually try to provide them with private health insurance. Imagine if instead of Medicaid, we gave, as part of healthcare programs and part of welfare, if you will, we gave them vouchers to buy insurance. It would be cheaper than Medicaid and 1,000 times better than Medicaid. But that would vindicate private insurance. And people would actually make a, God forbid, profit on it. And we can't have that, people making profit over poor people. That's unacceptable. The reason, Jennifer says poor people used to starve. Yeah, the reason poor people have food is because the food supply chain is actually private, efficient, drives costs down. And food is unbelievably cheap relative to what it was 100 years ago. So if you want to solve the problem of bad health outcomes among poor people, then bring to them, with regard to health, the same mechanism that you brought in regard to food. Private enterprise, the profit motive. And, you can do that both in terms of insurance, vouchers, for example. But you can also do that just in a sense of letting people open clinics. One of the things that I think could revolutionize healthcare if it was more private is, for example, every Walmart, and Walmart has talked about this for years, every Walmart would have a clinic in it that would provide you with basic healthcare, with preventive medicine, and it would be really, really, really cheap. I think some Walmarts already have it. But in a truly private system, without all the burdens of regulation imposed on healthcare. Every Walmart would have a clinic that would provide relatively poor people with superior results than anything Medicaid can provide them. Yeah, Walmart has started to do it in some stores, but they've been talking about it for over a decade, and the barriers are all regulatory. They're all regulatory. They're all government barriers. The market would love it. The other problem with poor people is that they tend to live in more densely populated areas. They tend to live in the cities, in apartment buildings, in much more densely populated, which is where you're more likely to get a disease like corona. And they tend to live in multi-generational housing, where the grandkids, the kids, and the grandparents all live in one home. And therefore, young people infect older people. That's where you need to think of solutions to get old people out of those homes and get them separated. So, but no, I mean, what the media and what the conventional kind of leftist rhetoric is going to be, it's going to be all about inequality. It's going to be all about the disproportionate amount of poor people dying, all about the disproportionate number of blacks dying, with no consideration to why that is, other than they're poor. And if they're poor, the only solution is to take money from those who are not poor and give it to them. The only solution they can imagine is redistribution of wealth, when the real solution is to privatize, bring them more freedom, bring them more services. But that's inconceivable in today's world. Economic inequality is not solvable and does not, you can't solve it. There is no such thing as economic equality unless we're all dirt poor. And you can't solve it because we're just not equal. We're just not the same. We just don't have the same skills, abilities, character, morality. We're just not the same. Therefore, the outcomes are going to be different. And then the question is not how do you reduce inequality. The question is how do you solve the problems of limited opportunities? How do you maximize opportunities? And here I encourage you to read my book with Don Watkins, Equal is Unfair, because all of this is covered in Equal is Unfair. So read it. You're not doing anything these days, just stuck at home. Read it. It's not inequality that's the problem. It's a lack of freedom. It's not inequality that's the problem. It's a lack of opportunity. And the way to maximize opportunity is to maximize freedom. And what maximizing freedom means is capitalism, limited government. All right, I want to say something about the economy. People, and then I know you sent a Super Chat question, Frank, but you're like 20th in line, and we'll get to yours after I'll do all the other ones. And before that, I'm going to finish this point, and then I'm going to start going down the Super Chat questions. I still have some Super Chat questions from the last show where my feed cut off and I didn't get to them, so we're going to do those first. So, the economy. I mean, people talk about opening up the economy as if they're talking about, I don't know, handing money to rich people or something, or this thing called the economy that we're going to open up. This is not about opening up the economy. This is about allowing people the freedom to engage in choices regarding their personal values. Now, some people might choose to stay home because out of fear of the virus. Some people might choose to go to work under certain conditions, wearing masks, social distancing, and so on. Opening the economy is not some, amorphous, abstract. It is abstract. But it's not something unrelated to you. It is about you. It is about increasing your freedom. It's about increasing your choices. It's about leaving you free again to pursue your values. And of those values, the value most important is productiveness. It's the ability to go out there and do work to produce the values that are necessary for your existence, for your life. Wow, Vonda is amazingly generous today. It's about producing, creating, building, making, doing the things that give us self-esteem. It's no accident that many of us feel down and a little depressed and a little antsy and restless because we're stuck home and we're not being productive. Because productive is not only necessary for our physical existence, it's necessary for our spiritual existence, for our happiness, for our success, for our well-being, emotionally and psychologically. So, it's freeing up the economy, opening up the economy, is about getting people back the freedoms that are theirs. It means stopping to violate people's rights on a massive scale. Now, again, I'm not saying you can't shut down New York for 2 weeks because it's an emergency. But we've shut down the whole country with very, very, very little, if any, scientific data evidence that it needs to be shut down as an emergency. How many people need to die for something to be an emergency? How many people have given that any kind of thought in terms of what an emergency actually is? And when it's appropriate for the government to use emergency powers? How many people have to die? Which hospitals need to be overrun? How many hospitals need to be overrun? Nobody's giving that thought. Nobody. And you can see it in the randomness and the second-handedness of the actions of little politicians all over this country. So the economy is you and me. The economy is our life. And think about the economy as an aggregate. If we don't go to work, where is the money going to come so that we can buy food? And if at some point the farmers don't go to work, how are we going to get any food? And if at some point the truck drivers don't go to work, how are we going to get the food from the farmers to the supermarket? And if the grocery store people don't go to work, I mean, it's absurd. Without going to work, there's no production of values. Without production of values, what are we consuming? The government is printing money to give to us. How long can that continue? I mean, theoretically, they can keep printing. But we know what happens if they keep printing forever. Money loses all value. That's called hyperinflation. When we stop producing, when there are no goods to purchase, and there's no people producing any goods for us to purchase, then you get hyperinflation. But the Chinese can produce, and we can consume all the stuff from China. Well, but at some point, the Chinese and the Mexicans and the people who are producing out there in the world, because they're not quarantined, they're going to stop wanting this paper money because the paper money doesn't represent anything. What the dollar represents, and the reason the dollar is strong and the reason the dollar is the global currency, is it represents the American economy. It represents our hard work. It represents the values we create, all of us. It represents American ingenuity. It represents American freedom. It represents whatever's left of capitalism in this country. And if you kill that, if you kill our ability to produce, if you kill our ability to work, if you kill our ability to create values, then the dollar means nothing. The dollar has no value. And people all over the world will not want it. So we won't be able to buy anything from anybody else in the world. That's Peter Schiff's ultimate collapse. And he's right. There's a point in which that has to happen. There's just no other way around it. I don't think we're there yet. But you keep doing this, and nobody has a plan to get us out of this. It has to happen. Now, it is true that a lot of the economy is not shut down. A lot of the economy is working. Luckily, a lot of us can still go to work. I still work. I'm working more now than ever before because everything I do is on the internet. Whether it's in finance or whether it's here, it's all on the internet. And a lot of the computer companies and a lot of those are still going to work, and a lot of what are called, you notice the essential workers? I mean, that's another joke. I mean, it's worse than a joke, right? Who gets to decide what an essential worker is? Do you know that in Puerto Rico, and I think in other places, marijuana weed dispensaries are considered essential and people can work there, but restaurants are not, bars are not, retail stores are not? I mean, essential to whom and for what? A value for whom and for what? Who gets to decide? Our central planners in chief. We have basically succumbed to a mentality of central planning. Again, you can have a shutdown for 2, 3, maybe 4 weeks. I can't imagine that. But then it has to be over quickly. But who gets to decide, even during those 4 weeks, who is an essential worker? Who is allowed to go in pursuit of their profession? Who is allowed to go out? Under what circumstances? Who gets to decide that? By what criteria do they decide it? So it's true right now, another form of inequality right now is that these laws are screwing blue-collar workers. They're screwing the people who can't afford to be screwed. If you work at a restaurant, if you work at a hotel, if you work at certain factories, you're not an essential worker. So you have to stay home. You get no income. Hedge fund guys, we can trade so we can get income. So, and then, of course, essential workers then are not giving a choice, some of them at least, and they go out to work and they have to risk everything and we just sit at home. I mean, the whole way of thinking about this is anti-individualist, anti-capitalist, anti-freedom. And of course, it's the consequence of living in a mixed economy. It's a consequence of living in a mixed economy. The mixed economy puts us into situations where on the one hand, you take away people's freedom, or the alternative is more people than necessary have to die, and hospitals go overwhelmed. That dichotomy, that choice, is a choice created by the mixed economy. It's created by the mixed economy. The reason we don't have enough doctors, the reason there are no masks, the reason there are not enough ventilators, the reason there are not enough hospital beds is all because of government. Every one of those things is because of government intervention. This choice, this evil choice between shutting down the economy and deaths and overwhelming hospitals is not a necessary choice. Doesn't have to happen. Even in the world in which we live, I don't think it has to happen. It certainly doesn't happen under capitalism. Certainly doesn't happen under capitalism. All right, I see we got a ton of Super Chat questions. Some of them are pretty philosophical, so we'll have to see. All right, we're going to go over these in, I guess, the order they were put in, even though some of them relate to Corona and some of them don't. And please don't do any more Super Chat questions because it's going to be hard for me to get all of these. Cook, that is a funny question. All right, we'll get to that. But you're in line, guys, and the line is long. So patience, and hopefully my computer won't crash. But please, no more Super Chats. Or if you do, then accept the fact that you might have to wait until tomorrow to have them answered. All right. Can you create a campaign to organize your audience to get you on Joe Rogan to talk about capitalism, freedom, and objectivism? I don't know how to do that, and I've heard that Joe Rogan doesn't like that if you launch a campaign, that actually gives you bad points or something. I would just suggest periodically, in a very respectful way, and maybe giving a reason, tweet Joe Rogan that he should have me on. But say why. Say something about, I'm a good speaker. I'm a normal guy. I'm not a nut job. I'm not obnoxious. I do good interviews. Hey, go check out Dave Rubin. He interviewed with Dave Rubin, and maybe link to the Dave Rubin interview so Joe Rogan can see that I'm a, sane human being that can do an interview, because he has this perception of objectivists as nuts. So if you do that, I think, if you tweet him, if you send him an email or whatever other format he takes, but you do it respectfully, you give a reason and you link to a show where I look sane. Are there shows where I look insane? Anyway, a show that looks sane, then that I think will really help. I get how objective reality leads to reason. Objective reality leads to reason. Why egoism leads to capitalism. But could you explain how reason leads to egoism? Now, you have to be careful here about what leads actually means. You have to be careful not to be overly rationalistic and looking for deductions from point to point, deducing all these relationships. Objectivism, like all new knowledge, is primarily inductive. Now, you can talk about the relationship between reason and egoism and why reason in a hierarchy, why epistemology in the hierarchy comes before, in a sense, egoism. But you have to be aware that objectivism is not a philosophy deduced from axioms and everything else is a deduction. Most of what happens when you're discovering new knowledge, i.e. what Ayn Rand was doing, is inductive. And then you use deduction to show the relationship between ideas. So what is the relationship between reason and egoism? Guys, you got to stop the super chat question. I said stop super chat questions because I'm dying here. Too many. It's great. It's money and it's good questions, but I can't keep up. Particularly if you ask these deep philosophical questions. Whoa, it's hard to get there. So reason and egoism is the first point I'd make. And by the way, if you really want to understand this, don't listen to me. I mean, if you really want to understand this, you got to read Objectivism, the Philosophy of Ayn Rand, OPA, by Leonard Peikoff. Leonard lays out the hierarchy of objectivism. He lays out the philosophy as a system, interconnected. That should be your primary source for questions like this, deep philosophical questions. And then beyond that, you got to listen to his courses on philosophy. So I'm going to give you my amateur version of this. Granted that I'm not a philosopher, and I don't claim to be a philosopher. I'm a finance guy who I think understands objectivist philosophy pretty well, really well, and can present it in language that is accessible to most people. So, who reasons is the question you have to ask yourself. Who reasons? And what is the purpose of reason? That is, what function does it serve? Well, only individuals reason. Only you as an individual can think. So only individuals can reason. So the focal point needs to be the individual, the group, the collective, the other. Can't reason for me. Only I can reason for me. Reason is an attribute of the individual, not of the group, not of the collective, not of others. But it's you. So that already orients you towards the individual, the person, the ego. Second, what purpose, what function does reason serve? Well, it serves the function and the purpose of survival. It is the mechanism by which we survive as individuals, by which we use it to do what? To survive, to live. We can't survive without it. And even if you're a parasite living off of other people's reason, other people's thinking, it's still true that somebody has to use reason in order to survive. Even for you to survive, they have to use reason. So someone has to use reason. Reason is the mechanism by which individual human beings survive. Whether you do it for yourself, in a deep sense, only you can do it. Or if you leech over other people, then other people have to let you leech off of them, and they are using their reason. So the function of reason is individual survival. Your survival. You think so you can survive, so you can live. So it's all about you, the individual. Reason is man's basic means of survival. So only you can think, and thinking is required for your survival. And now you get to ethics, and you ask questions in ethics, which Ayn Rand asks about values, and what is a prerequisite for values, and the prerequisite for values is life. Well, what I need in order to live? I need to reason. And therefore reason and ethics are integrated completely. And reason and egoism. Well, whose reason? My reason. And my reason is the only tool by which I can survive. So that's the best I can do from a super chat question on the spot in a short period of time. All right, is this, the coronavirus, a trigger, like Peikoff discussed in DIM, a trigger for authoritarianism? It certainly could be. I don't think it is, because I think Americans are not quite soft enough. But if it's not, then it'll be a great softener for the next trigger. Remember, I think 9/11 was a trigger. It moved us a long way towards authoritarianism. It moved us a long way away from the American sense of life. I think 2008 was a trigger. It moves us a long way from capitalism, and a long way towards authoritarianism, and a long way towards viewing government as the solution. I think this is a trigger. Every trigger moves us closer. It's not one event, boom, it's all gone. But it will be an event that shifts us from we're still a little bit free to we're completely authoritarian. I don't think it's this, but every one of those. I mean, Obamacare was a consequence of 2008. See, I want to say something about voting here, because it just reminded me, Obamacare reminded me of that. I know, I'm always accused of, arguing to vote Democrat sometimes Republican, this time Democrat. How can that be? The Democrats are so much worse. Well, in 2004, I voted for John Kerry over George Bush. It was the first election I could ever vote in. And I held my nose. I hated John Kerry. I still hate John Kerry. And I voted for Kerry. And I wish he would have won. Because imagine Kerry president when 2008 financial crisis hits. A lot less likely you blame capitalism. A lot less likely that the solution to it, bailouts, massive stimulus, is attributed to a capitalist president, George W. Bush, or to a pro-capitalism president. It's very likely Kerry loses in the 2008 election to a Republican, which means you never get Obamacare. You never get Obama, and you never get Trump. So I think just that one strategic vote in 2004 could have changed the trajectory of America quite dramatically. Quite dramatically. Just 2008 triggered that. Hey, Ron, thanks so much for being a voice of reason during this pandemic. You are greatly appreciated. Thank you. On a serious note, you mean that wasn't serious? I'm not a voice for reason? You were just kidding? On a serious note, what is your favorite kind of cuisine? And what's your favorite dessert? So my favorite type of cuisine is what I would call modern Spanish. My favorite place to eat food is very, very high-end, sophisticated, what would you call it? Innovative, different, modern, weird restaurants in Spain. Sometimes molecular gastronomy, some of it's molecular, but just generally flavorful, interesting, entertaining, colorful, an experience. I love cuisine that's an experience. There's certain restaurants in the United States, probably the best in the United States is a restaurant called Alinea in Chicago. It's super expensive, but it is a once-in-a-lifetime kind of celebration of food, of life, of color. The food is unbelievably flavorful, complex, interesting, yummy, beautifully presented, and unusual in the sense that you'll never eat anything like it again in your life. I love food like that. That is my favorite cuisine. I prefer that on pizza. I love pizza, although I don't eat pizza because it's full of carbs. But I have very, very expensive tastes when it comes to food, which makes this pandemic really, really bad for me because now I'm relying on restaurants that do takeout and the food is mediocre. There's only one restaurant with good takeout food in Puerto Rico, and it's only open 3 nights a week, and this week it was closed completely, and so it's created havoc in my gastronomical life. I don't have a favorite dessert because I don't eat dessert. Part of my diet is I try to avoid sugar. So if you have a dessert that doesn't have sugar, then I'm all in. I don't know, a green tea panna cotta with very little sugar in it. That sounds good. Ooh, I'd love a green. Anybody have a green tea panna cotta right now? That would be so good. Anyway, it would have to be a dessert that wasn't very sweet. That would be my favorite dessert. And I just don't eat dessert because what usually happens is it's too sweet and I don't enjoy it and it kind of ruins the meals for me. So often I will just tell the restaurant, I'll do a prefix dinner, but I won't do dessert. Okay, I'll ask, since everyone is talking about it, will you give your thoughts to Tiger King, the hit Netflix docuseries? It's hugely popular. I have a very simple answer to that. No, I'm not interested. Don't care about it. I'm not going to watch it because it's popular. I know it's the cultural thing everybody's talking about. It just doesn't sound interesting to me. It sounds boring. So somebody is going to have to convince me that I will achieve some kind of value by watching it that I will not attain in my life without watching it. So I don't know what you do with that. Does the prohibition against the suspension of the private privilege of the writ of habeas corpus in Article 1, Section 9 make this shutdown unconstitutional since we're effectively imprisoned? Good question. Don't know the answer. You'd have to ask a constitutional lawyer. It is true that such shutdowns have occurred in the past in American history, and certainly they are legitimate under certain circumstances. But I think what is missing is an objective articulation of those circumstances. So I'll give you an example. Is it a violation of your property rights to say that in World War II London, you're not allowed to turn on the light in your home at nighttime? And the reason we don't want to do that is because that's where the bombers go and they're likely to bomb your neighborhood because you turned on the light and you're giving a torch for the bombers to come and bomb you. Well, it's completely appropriate under circumstances of war, under circumstances like that, to tell people, in spite of your property rights, you cannot turn on the light because you're putting so many people in objective danger by doing so. You're going to have to live in the dark until this crisis is over. There are circumstances where you could restrict people to their homes in an emergency. But again, emergency have to be finite and have to be clear what the definition of no emergency anymore. So a declaration of war is objective. And when victory is declared, the declaration of war is rescinded and the emergency is over. You'd have to have something like that in a pandemic. And it would have to be objective and clear. And again, not every disease that is infectious deserves an emergency. Who gets to decide? I mean, I think Congress should decide. But those are the kind of things that you would have to figure out and how that fits into the protections of the Constitution. Because the protections of our Constitution recognize the existence of emergencies, of context. Sometimes in rare situations, in emergency situations, in order to protect life, in order to protect rights, one has to restrict them in narrow domains. In narrow domains. And that is completely consistent with rights, with protecting rights. That is not a violation of rights. I'm not saying rights are irrelevant in emergencies. They're very relevant in emergencies. Thank you for your rational input in this wacky time. My question revolves around making friends with some same values. I simply can't. Those values or the ambitious people at work, any thoughts? I simply can't. Whose values or the ambitious? Yeah, I'm not sure I understand the question. So let me try to understand it. So my guess is the question is, I can't make friends with people who don't share my values. I mean, that's right. I can't make friends with people who are not ambitious at work. I mean, that is completely legitimate. So friendship is contingent on values, on shared values. Friendship is about that sharing of values. It's about the reflection. It's about visibility. It's about the reflection of those values in the person of somebody else, in the existence of another human being. That's what love is. That's what friendship is. Love is just on a different dimension. Right? Different, in a sense, a different category, but share lots of similarities. And sharing of values is one of those similarities. I think that's the question you asked. I apologize if I misinterpreted it. The Yes Minister episode. Yes Minister is a must-see television show, one of the great television shows of all time. The Compassionate Society focused on an NHS hospital which had 500 administrators and 0 patients. That sounds exactly like Yes Minister. They also had no doctors. Do you think this might be based on any actual events? Yeah, I do, actually. I think there are probably hospitals out there. I think there's one in Puerto Rico, which were built and became white elephants because they don't have the doctors to fill the hospitals. They don't have the money to buy the equipment for the hospital. But they have lots of administrators who, think that the hospital is needed and built the hospital and took public money and gave it to contractors and got it built. So not exactly the way it's presented, Yes Minister, but Yes Minister is basically making fun of the phenomena, which is absolutely true. You find universities with massive numbers of administrators, when 50 years ago they had very few. I'm sure hospitals are the same. I'm sure there are many, 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 many more administrators today in hospitals than there were 50 years ago. And administrators have not made the hospital safer, better at producing a product, healthcare. They've made them more bureaucratic because, it's not the administrator's fault, it's the government's fault. So yeah, I'm sure that episode is hysterically funny, and I would recommend Yes Minister to everybody, and that episode sounds particularly good. All right, here is a philosophical question, again, from Leonard Peikoff's dim hypothesis. Now, I have to again say that I'm not really qualified to answer these philosophical questions, particularly ones that are related to dim, because dim is a difficult proposition to understand, and I'm not sure I apply it always right. But anyway, so D2, that's disintegration, a commitment to disintegration, nihilism, basically, is strong enough to destroy the I, but not strong enough to destroy the M2, which is so equals weaker than I. Why? And why does D1, weaker than D2, do a better job than D2 at destroying M2, like communism? I mean, this is why you can't take these terms rationalistically and out of context. And I don't know if you've read the dim hypothesis, but this is not how the dim hypothesis views things. It's not a matter of stronger or weaker. It's a matter of what, under certain cultural circumstances, is attainable for people. So D2 is not an issue of strength. D2 is not palatable to people. D2 doesn't destroy the I. Nothing destroys the I. Let me say it again. Nothing destroys the I when the I is consistent. What destroys the I is the inconsistency of many I's. In this case, I is integration. The inconsistency of the Enlightenment. The inconsistency of the Enlightenment defense of reason, of capitalism, of individualism, of freedom, of science, of reason. Kant destroyed the Enlightenment, not D2, and Kant destroyed an inconsistent I. And he didn't destroy it because it's inevitable that he destroys it. He destroyed it because there wasn't a strong enough representative of I to defeat him. If Ayn Rand had been alive when Kant was writing, she could have defeated him. But there was no Ayn Rand. There was no proper representative, consistent representative of the ideas of reason and individualism to defeat Kant. And Kant ultimately, his influence in the culture is not to turn everybody into a D2 and that defeats I culturally. What defeated culturally was D1. That is the drift of an inconsistent I into disintegration. Not full disintegration, partial disintegration, a little bit of integration, a little bit of disintegration. And then D1 culturally drifts into D2. But D2 is actually not palatable for people, not palatable for people out there. I'm getting to that, right? So D2 is not palatable for people. Then, because people need integration. At some level, they need it. That's why D1 is much more long-lasting than D2. D2 is a flash. And out of that flash of violence, flash of mayhem, flash of anarchy, people revert immediately to an M2. And the only thing, and what will defeat M2 is some kind of resurrection of an I. So D1 doesn't destroy M2. What destroys M2 is an I. What destroyed the Dark Ages is Aristotle. It's the acceptance of a proper form of integration. D2 happens in very short periods of time. It's because it's not an equilibrium. It's not sustainable. I mean, it can last decades, but it's not likely to last decades. Particularly not in a country like America, I don't think. Right? So again, you can't view this as some kind of diagram or what defeats what. You have to understand how the idea of disintegration, the epistemological methodology of disintegration or misintegration, how that applies to cultural phenomena, how it applies to science, how it applies to education, how it applies to art, and how it applies to politics. And then how the ideas that spread in a culture, and how that spread leads to what? And the only thing that can ultimately defeat M2 is the spread of good ideas, the spread of I ideas. And it can take hundreds of years, as it took from the end of the Dark Ages to the peak of the Enlightenment. But ultimately, good ideas win. I wins. Communism is a form of M2 that results from a state of anarchy. Nazism is a form of M2, but weak M2s. They're not good integrations. They're not sustainable integrations. Now, M2 is weak. D2 is weak. They're all weak in face of a consistent integrated philosophy. But to get a consistent integrated philosophy and to get it accepted in the culture, that is the struggle and that is the challenge. Yeah, a state of anarchy is a state of pre-civilization. It is a state of no integration, of no law, of no integrating methodology in politics or in any other aspect of life. And what fills the gap of a state of anarchy is almost always authoritarianism. So whether the anarchy of pre-civilization, right, is filled with the integration of a city-states in Greece. But Liberal Deutsch, you should really, have you read the Dim Hypothesis? Have you read the book? I'd really recommend reading it. If you've read it, then I'd recommend reading it again and then listening to what I say, and hopefully I'm representing it right. But it's a challenge to represent it right because it's not an easy idea. But a state of anarchy is what human beings have in barbarism. So the Dark Ages are anarchy. And the only thing that integrates them is religion. And that's why religion rises to dominate. And other forms of integration that come out of that are the states, is the creation of states as an integrated factor. Some are misintegrated. Religion and states that are arbitrarily created. And some are integrated, like states that are integrated around an idea. The United States of America is an example of an integrated country, integrated culture. All right, wow, we've got tons of questions. Okay, some media and intellectuals are intent on advertising maximum fear and attack anyone who doesn't agree with lockdowns and worst-case scenarios. Why are they so committed to the protective of fear? Well, because partially they are fearful. They thrive on emergencies. They get adrenaline kicks from emergencies. They get adrenaline kicks from power over other people. And it reinforces their beliefs that what we need in society is order. What we need in society is planning. What we need in society is government, everywhere, all the time. And what they're trying to convince you is that freedom, capitalism, people doing their own thing, people living by their own values, people producing, creating, building, that's mayhem, and that causes death. And they want you to associate that. Now, again, I don't think they're necessarily conceptual about it, but I think that's what their subconscious is feeding them. And some of them are just motivated by fear. Some of them just can't think. That's true of people in the administration, for example. A lot of the politicians who might not be power lusters, but they just can't think. And what do you revert to when you can't think? Well, emotions. So, and death is scary. Science is scary. A virus is scary. A pandemic is super scary. And since they can't think, they're scared. They're scared. And look, the only way to think, and this is one of the best lectures by Leonard Peikoff is about thinking in principles. The only way to think is to think in principles. If you're not thinking in principles, you're not thinking. And yet we have an establishment from Trump through Congress, through the governors, throughout society that don't believe in principles and therefore can't think. They can't think. There literally is no thinking going on about this crisis. Part of the great tragedy of this. Brian, anarchy is gang warfare. I am saying that. It is, it has to be, there's no other way to do it. You're saying under anarcho-capitalism, protection agencies mutually agree to contract our individual rights. Why? I start a protection agency that doesn't recognize rights. And I happen to have a nuke, or I happen to have really big weapons. How are you going to stop me? By what standard? There's no reason in the world why private protection agencies are going to respect rights. Now, some might. I've read David Friedman. David Friedman is nuts when it comes to this issue. He's wrong and he's nuts. The non-aggression principle cannot be violated. Who says? Who enforces that? Who is the final arbitrator of what is aggression? Somebody has to decide what aggression is. So who gets to decide when it's being violated and when it's not being violated? Today, we have a government exactly for that purpose. There is no market for defense. You cannot have a market for defense. The market for defense is the guy with the biggest guns wins. Anarcho-capitalism is a contradiction in terms. You cannot have anarchy and capitalism. Anarcho-capitalism is nothing but the negation of capitalism, freedom, individual rights. It's even the negation of a non-aggression principle. And David Friedman is blatantly wrong, and he presents data and information that is blatantly wrong. And it's when you actually go dig about Iceland and things he like, or Sharia law, which he uses as an example as private law, that is insanity. There's no exactly that. I've seen David Friedman on stage make a presentation where his example, of private defense forces, private courts, a Sharia law courts in Somalia. What respect of individual rights? Indeed, David Friedman will be the first person to tell you that he doesn't believe in individual rights. They're nonsense on stilts, according to Friedman. So, no, anarchy is inconsistent with capitalism. It's inconsistent with freedom. It's inconsistent with reason. It's inconsistent with egoism. It's inconsistent with human life. With human life. And there is no such thing as minarchism. I'm not a minarchist. And there is no contradiction in objectivist view of government. You have to see it, you have to understand the objectivist case for government. You have to understand what individual rights are. But there is no market mechanism to protect rights because the market exists where rights are protected. Rights have to come before the market. How can you have a market in rights when you cannot have a market without rights? Think about what I say. How can you have a market in rights, in right protection, when a market has to implicitly have already the protection of rights in order to exist, like property rights? Property rights come before a market. You cannot have markets if you don't have property rights. I mean, just hierarchically, conceptually, and in reality, anarchy cannot exist, and all anarchy has ever led to and will ever lead to is violence, death, and destruction. at the risk of flirting with conspiracy theory, which economy do you think will be most hurt in the long run, US or China? Does the CCP have something to gain by seeing zero growth in the American economy? No, it doesn't. So this idea that the world economy is a zero-sum game is nonsensical. China has nothing to gain from the US having zero growth. Indeed, China has everything to gain from the US having 20% growth. The higher the growth rate of the GDP of the United States, the higher the potential growth rate of China. And the other way around. The United States gains nothing. The United States gains nothing from China having zero economic growth. We want them to have a robust economy so we can have a robust economy. So we can trade with somebody. So it's the same as I don't have an incentive for you to be poor. I want you to be rich. The richer you are, the more products you provide, the more values you create that I benefit from. It's a win-win relationship. So who's going to be hurt more by this? Well, China is. Because China's system is authoritarian. And now it could be that China killed this virus earlier, so it will benefit because it managed to get it under control faster than the US, if you believe the Chinese numbers. But China's economy is a disaster. China does not benefit from pain in the US. Contrary, China wants us healthy so we can buy lots of their goods. And we need China healthy so we can buy lots of their goods. And by the way, China buys a lot of our goods. It needs us to be able to produce those goods so it can buy it. And China needs Apple to be healthy so that all those apples can be produced in China. Without the idea generating part of Apple, the manufacturing part of Apple in China is meaningless. It's worthless, zero value. All right. Stock buybacks, rational or irrational? How do they benefit shareholders? Taxes. Are they long range? Is Fed creating perverse incentives? Yes, Fed is creating massive perverse incentives. Are stock buybacks rational? Absolutely they're rational. They're an amazing way to get capital from the hands of those who don't have good investment opportunities into the hands of those who do. Now, you could do, so if a company, I've said this before, but I'll say it one more time. If a company is making a lot of money and it doesn't have a lot of investment opportunities, that is, the money's sitting in the bank and it's not earning shareholders a good return because the bank is paying, 1% on the money. And the shareholders, if the shareholders had the money, they could invest it in productive activity that maybe could generate 10% return. So the rational thing, the economically rational thing, and the morally rational thing is for the company to give that money to its owners, which are the shareholders. Now, I could do it through a dividend. But if it does it through a dividend, then the shareholders have to pay taxes on the dividend. Taxes on dividends are regular income. They're taxed at the top marginal income tax rate. Well, actually, at your income tax rate. Or they can do a share buyback, which drives the stock price up because the number of shares gets reduced. But it also drives the assets of the company down. So over time, it doesn't affect share prices. But it gives it to them in a stock buyback, which allows the shareholder to take a capital gain. Capital gains are taxed at a lower tax rate. So the shareholders get their money back, but they get money back more efficiently from a tax perspective through stock buybacks. So stock buybacks are a way for companies to return capital to their shareholders when they don't have good investments to make with the capital. And if they have great investments to make, if they can earn a great rate of return on their investments, they should invest it because that's what the shareholders hired them to do. But if they don't have those investments, then rather than waste the money, which many businesses do when they have a lot of cash, and if you stop buybacks, then what companies tend to do is make bad investments, which are destructive to capital and destructive to the economy. I should just teach a class in finance explaining these concepts, because there's so much ignorance out there. So much ignorance out there about how companies work and where the money that they bring in goes, and you know, how do you figure out what a productive investment is and isn't? Right? And stock buybacks are often the best investment a company can make. Is Fed creating perverse incentives? Massive perverse incentives. By not allowing stock buybacks, the government is creating incentives to make bad investments. Now the Fed, I was going to talk about this. The Fed is basically buying up anything, any form of credit, bonds, any kind of corporate credit. In other words, the Fed is subsidizing now all American businesses who have debt, lowering their cost of funds. So instead of the market now determining how risky a particular investment is, how risky a particular company is, or maybe even driving a particular company into bankruptcy, the Fed is not allowing that. The Fed is basically saying, no, all these companies have little risk. All these companies are, whether it's risk-free or low risk than they would otherwise have, which means there's massive amount of investment in companies where nobody should be investing. Fonda today is going overboard by supporting me. Thank you. Thank you. Thank you. So the government is creating massive perverse incentives to create massive misallocations of capital, massive malinvestment. Now, we'd have to do a whole show on that. Okay, here's a quote, I guess, from Atlas Shrugged. It seemed to her, Dagny, that some destroyer was moving soundlessly through the country and the lights were dying at his touch. Parallels to today. The real parallel to today is not that there is a destroyer doing this purposefully, but or a person who is a destroyer. The destroyer today are bad ideas. The destroyer today are the ideas of collectivism, altruism, and statism that are slowly turning the lights out in our economy, in our world. It is the philosophy of altruism, of irrationalism, mysticism, of all forms, including the form of not understanding how to think probabilistically, not having data, acting without information, acting on fear, acting on emotion. All of that is anti-reason. It's anti-reason, anti-individualism, and anti-capitalism, those ideas, in whatever form they take on the left and on the right, that are destroying this country, are turning the lights off, are putting us in quarantine. And we don't care, because we've bought into those ideas. And fear is the dominant thing. Are we going to retest the lows in the stock market? I think so, because I think that, for a number of reasons, I think that the S&P hasn't come down a lot, given the damage that is going to be caused to this economy. I think the virus isn't over yet, because I think that once they open up the economy, given that they're not doing the testing and isolating, and they're not isolating the sensitive people, they're not doing the right things, that more people are going to die, and there might be another round of closing down the economy again, and that isn't priced at all into stock valuations. So I think a lot isn't being priced. I think the bad news isn't being priced. I think the bad news economically isn't being priced, and I think the bad news from the virus perspective isn't being priced. So I would not be surprised at all if we retest the lows. And on S&P, if we go way below the lows. NYC Classical Radio Station is more interested in how kids feel about a piece of music in response to it instead of what they think about it. Why? Well, I think they're right. Music is not about the why. There is no why. I mean, there is a why, but you don't know what the why is. If I ask you why you feel a certain way from a piece of music, you can't really tell me. We don't understand the mechanism that turn a piece of music into an emotion. You can do that with a painting. You can certainly do that with a novel. But in music, we don't have the language, we don't have the tools, we don't have the science, we don't have the knowledge to transmit why did this pattern of notes, harmony, melody, whatever, cause this kind of emotion. So what we want to know is how does it make you feel? And the value that music provides, and indeed the value that all art provides, is the feeling you get from it. The emotion is the reward from the art. It's how it makes you feel. That's the most important question to ask somebody. How did that movie make you feel? You can learn a lot about a person. And you can learn a lot about yourself in how art makes you feel, and then trying to understand the why. But trying to understand the why is secondary to how it makes you feel. And trying to understand the why is almost impossible or very difficult to do in music. Much easier in the other arts. I strongly recommend reading the Romantic Manifesto. There's a whole chapter, or one chapter, where music has a big piece of it, and where Ayn Rand describes her theory of music. How is ethics a science if there is no test tubes and equations? Science is not about test tubes and equations. Science is about using a particular methodology, and primarily an inductive methodology, in understanding the facts of reality and integrating them. So science is about integrating facts by a specific methodology of induction, and then checking and testing whether those facts are true or not by use of both deductive reasoning, which integrates across your knowledge, and through testing. And in ethics, the test is history, your own behavior, other people's behavior around you. You've got lots of experiments going on all the time. It's just not test tubes and equation, but test tubes and equation is not what categorizes, what identifies a science as a science. Even though facts exist independent of your consciousness, isn't how you interpret those facts subjective? No. I mean, it can be. But your responsibility is, what reason requires of you, is to figure out what is objective, what is true, what the fact is. Subjective, the fact that you do it, that your mind is doing it, doesn't make it subjective. If your mind is doing it using the correct method, which is logic, as applied to reality, the facts. What gives it objectivity is the method and the fact that you are relating to facts. Again, good questions, you'd get even better answers if you asked, if when I had Greg Salamieri or Onkar Ghate on, or ideally if you just went to OPA, where he talks about these things. OPA, Objective and the Philosophy of Ayn Rand, Leonard Peikoff's book. What are your thoughts on the attacks on 5G networks? Americans seem to either not care or they're afraid of it. Oh, well, have you heard the conspiracy theory that 5G networks are causing the coronavirus pandemic? That what the Chinese have done is that the 5G networks, so the virus gets in your body, but then the 5G network triggers something in the virus that the Chinese have implanted in it, and it's what causes you to be really, really sick. And that's why in some countries they're burning the 5G towers because they're made in China, and they're burning them because they think that by burning them they'll get rid of the coronavirus. I mean, the insanity of this world. And the fact is, I've seen people online actually advocating for this seriously. I know that coronavirus is not in 5G, even if you didn't guarantee it. I mean, it is so laughable. I mean, coronavirus, we actually can figure out its RNA. We can actually sequence it. We can figure out what drives it. We know enough biology to know exactly how it works. I mean, it's pretty amazing how much biologists know about this. But yeah, there's a whole 5G network conspiracy theory around the coronavirus. I think the attacks on 5G networks are nuts. They're insane. We have to be careful that the Chinese are not implanting surveillance devices in our 5G or anything that we buy from China. Let's hope that both the NSA and our own companies like Apple and Google and others, are aware of this, aware of the potential for the Chinese to put stuff in there that can monitor us. And are preventing us from getting it. But and if to the extent that the Chinese try to put stuff in products that monitor our behavior, then that should be a massive. There should be massive condemnation of that and massive repercussions, diplomatic repercussions from something like that. But you'd have to have real proof, real evidence. And I'm all for 5G networks. I want 6G. I want faster the better. I think 5G is great. And yes, I don't think it's the 4G LTE that is related to Corona. I think it's the old 3G networks. This has been planned for a long, long time. Anyway, ethics is a science. There are test tubes and equations of a sort. See Chapter 7, 8, and 9 of Objectives in Philosophy of Ayn Rand. Leonard Peacock to visit the lab. Yes, I mean, it's not literal test tubes and equations. It's history. It's introspection. It's observing the way people behave around you. It's observing what works in the real world and what doesn't in terms of human behavior. So ethics is an inductive science. And yes, the lab is the world. There's just no equations, that's true. But science doesn't require equations. Biology is not about equations. How can you tell when someone is honestly confused or evading? Somebody asked me this last time. I mean, you present them with facts. And more facts and more facts and more facts. And at some point, they don't get any of it. You have to conclude that they're evading if the facts are well presented and are clear. Isn't shutting down the economy just as bad as eliminating free speech? In a sense, yes. If this happens again, isn't some level of civil disobedience required? Yes. But you need people who believe that. You need people who want to be disobedient. And it's hard to be disobedient, civilly disobedient when you're socially distancing. No, but it's civil disobedience can happen when enough people believe and are willing to fight over the fact that their rights are being violated. I don't think there are enough people who believe that their rights are being violated right now. Will the West get close to dictatorship in the next few decades, but never go all the way? Possibly. That is possible, that it gets closer and closer and closer, and then we save it, and it avoids actually becoming completely authoritarian, particularly the United States, but maybe even in Europe, it never actually quite makes it there. All right, I'm exhausted. It's an hour and 45 minutes, too long. Lots of Super Chat questions. I really appreciate that. Probably do a show tomorrow. We'll see. Although this one is long, and I'm doing an event for AOA tomorrow. So we'll see. But anyway, I'll definitely do a show either tomorrow or Sunday. Have a great weekend. Enjoy yourself. Go out, take a walk, have a swim if you can, if they allow you. Express yourself and be productive. Find ways to be productive in your own life. Find ways to achieve happiness, to achieve values in your own life within the context of what you can do right now. Live long and prosper. Wasn't that from Star Trek? Live long and prosper. And stay healthy, guys. All right. Thanks, everybody. Have a good night. Don't forget to share, to like, and to contribute to the show. Thank you again, Vonda, for the amazing contribution today. And those of you who do not use Super Chat, you are free to use Subscribestar, Patreon, and the Yaron Brook Show website in order to contribute to supporting this show, contribute to your values. Thanks, everybody. Bye, everybody.